We're going to go over HCG preparation instructions for Zevavert 5000 IU. The same instructions apply for Gonasi 5000 IU. So the first thing you're going to do is gather your supplies. That is going to be the Zevavert or Gonasi, Torbac, this is bacteriostatic saline, a 5mm syringe, a red filter needle, a blue needle, a 10mm sterile glass vial, and your sharp spin. So the first thing you're going to do is prepare your work area. Set up on a clean, disinfected surface and wash your hands thoroughly. I've done that already. You're going to next open up the Zevavert box. What you're going to see in here is the HCG vial and the needle and syringe that comes with it. We're going to discard all of this because we do not need this. We just need the HCG vial. The next thing we're going to do is draw up the saline. So we're going to snap open one Torbac ampule of bacteriostatic saline. It has a dot. What we're going to do is I'm right-handed, so I pick up the top with my right hand, my thumb goes over the dot. I hold the body of the ampule with my left hand. You can see that my thumbs are at a right angle. I'm going to turn my knuckle in and I'm going to lever, snap. I'm going to discard the sharp. I am then going to attach a red filter needle to the 5mm syringe. I will take the 5mm syringe, open it up from the top. I'm going to open up the red filter needle. As you can see, the filter, I'm going to press it on, nice and firm, and I'm going to take off the red shield. What I'm going to do is I'm going to put the needle into the Torbac and draw out the Torbac. This is bacteriostatic saline, essentially salt water with alcohol, and the alcohol acts as a preservative. I'm going to discard the Torbac into the sharp spin. I am next going to take the needle off by resheathing it, undoing it, and I'm going to apply the sharp blue needle. Again, I open it from the top and I press on, take the sheath off. What you can see is we have a little bit of air in here. We only want exactly 5mm, and they overfill these ampules because they have to account for something called the dead space. The dead space is from 0 to the tip of the needle, so they must give you slightly more. So we are going to discard the rest. So we want exactly 5mm to go with 5000 IU, which is obviously logical. So I'm going to press up. I'm going to press up to 5. Okay, so I'm going to flip the cap off the HCG. And I'm going to insert the needle into the central rubber ring. I'm going to depress the plunger very slowly. Everything is done very slowly and meticulously. There's no need to rush any of this. So put a mil in. HCG is fragile, so you don't shake it, essentially just roll it around, and we're just trying to dissolve the powders. What we're going to now do is we're going to depress the plunger now that the powder has dissolved. That's going to create a pressure, so when I take my thumb off or gently release the pressure and put the tip of the needle into the solution, the liquid will come out. So I'm very gently pulling on the plunger to make sure I get exactly all of it out. So I now have 5000 IU in 5mm. What I'm going to do is I'm going to sterilize the top of the 10mm rubber on the vial, and I'm going to depress the needle into, again, the central ring here, fully in, and just gently press on the plunger to allow the liquid to come into the 10 ml sterile vial. Again, nice and slow. I do it to the side so it doesn't cause any bubbles, and again, minimal disruption. So I've just placed 5 ml into a fixed space. So I'm going to take my thumb off the plunger. You can see the barrel of the syringe comes up because obviously we want to equalize the pressure. So it goes back up to 5, and when it gets to 5, I take the needle out. I dispose of the needle into the sharp spoon. So what we have here now is 5,000 units in 5 ml of HCG. Okay, so we are now ready for our first injection or putting this straight into the fridge. HCG must be refrigerated at all times. I only ever take my HCG out to do my preparation of the needle. I put it straight back in the fridge because temperature is important in maintaining efficacy of the product.